Okay. Good evening, everyone. Let's try to get to our seats. We're going to try to get to our seats. There we go. We're going to start in 2 minutes. So if everybody could please go to their chairs, that would be great. Okay. Okay, we're going to start the program now. So here we go. We want to end at 9 o'clock, which I committed we'd be able to do, and I know we can do it. So I'm going to ask everybody to have their attention and go to their seats. Please, I beg you. Hey, Dan. Jim, louder? If everybody can please go to their seats. There we go. Jim, hit the thing. Hit the glass. All right. Well, good evening, everyone, and thank you so much for joining us this evening. It's wonderful to see so many friendly faces back here this evening. My name is Kevin Rigby, and I really have the privilege of being tonight's Master of Ceremonies for the 2025 Alliance for Aging Research Heroes in Health, an evening to celebrate trust, empowerment, and healthy aging. First and foremost, isn't this a stunning room? Now you say, why did we select this room? And the reason being is, tonight, we have the most people that have ever attended an Alliance dinner. We have over 325 in attendance. This is the most ever, so thank you. Now we know that there's a lot of incredible causes that you can support and to be in attendance for, so we have to tell you it means the world to all of us that you're here to celebrate us and champion the Alliance mission as the leading nonprofit organization dedicated to changing the narrative to achieve healthy aging and equitable access to care. The Alliance strives for a culture that embraces healthy aging as a greater good and values science and investments in advanced dignity, independence, and equity. It is an organization known for capturing the full potential of their vision by working together with partnerships like your organizations, whether it be policymakers, educators, and partner organizations. The Alliance creates educational materials and leads advocacy efforts to provide equal opportunity for fair treatment for every person as they age. One of the things I wanted to point out, and I'm sure all of you read a lot, but to me what was most powerful about the Alliance is that the national, local, and health policy media, along with our many partners, they look to the Alliance as a trusted resource of information. But perhaps equally important, they also provide provocative voice to push the envelope from where we are to where we should go. Since we saw you last year, the Alliance has earned more than 160 press hits. They've educated Medicare beneficiaries about changes to Part D options. They sounded the alarm on cuts to health safety net and key federal health care programs. And most importantly, they've empowered tens of millions of older patients and family caregivers with resources to help them live informed, independent choices about their own care. Now that's what you're supporting here tonight, and that's just a tip of the iceberg of what the Alliance does each and every day. Now every contribution and every effort is going to help us propel the mission forward. So tonight, we have an exciting opportunity for you to play a direct role. So how are you going to do that? So on your table, everyone, is you have a little icon where you can view items for the silent auction. If you would take a look at that, you can take it during this cocktail hour. Please check them out from your seats. You can click on the Donate Now button on the iPad centerpiece, scan the QR codes. The silent auction was put together in partnership with the Alliance board member, Jay Reinstein, who has worked hours to make this happen, and he's got a lot of special goodies for you tonight. So please take consideration, and hopefully you can go home with one or two or many of the items that are there to be donated. Not only will your bids help fuel the initiatives, but it also gives you something special to take home with and continuous. Now, the auction closes at 8 o'clock. So at 8 o'clock, the auction is over. So I encourage you, if you can, please take a look and get your bid there. So right now, I'm going to ask everybody to turn their attention behind me. There's going to be a video. I'm going to wait. Shh. Okay. Right now, I'd like to bring your attention to the screen behind you. This is just a glimpse of the powerful things that the Alliance has been doing over the course of the year, and I know you will be impressed with this video.
Think of your fellow man, lend him a helping hand, put a little love in your heart. You see it's getting late, oh please don't hesitate, put a little love in your heart.
What an impressive video. And how does it all come to being? Well, it starts at the top. And it's my privilege to introduce to you our dynamic, inspirational leader, the president and CEO of the Alliance for Aging Research, Sue Peshin.
In mid-January, days before the inauguration, the Alliance sponsored a briefing hosted by the Hill newspaper on trust in science, the high-stakes game for U.S. public health. Not surprisingly, there were a few mixed reactions about our decision to do this. A lot of organizations and companies were scared. I gathered our board and entire team to weigh in, and we decided to go for it. Our main purpose was to put a stake in the ground in support of science and to open a door for our partners, to let them know that we were speaking up so maybe they could also feel safer doing so, and that we would lock arms with them when they needed it. We knew it was a risk, but more than 51,000 people tuned into our live stream on Hill.com, YouTube, Facebook, and X, and hundreds of thousands checked it out following the event. And we're still here. And I'm proud of us doing that right out of the gate. This brings me to our first theme for tonight's celebration, which is trust. Today, we're often following different narratives from each other, depending on where we consume information. And it doesn't have to do with asking questions, because that's what science is. It's about losing our collective agreement on who is an expert and who's worthy of trust. We agree that when we need to get our car fixed, we look for a good mechanic who's been trained and has experience. And if we need surgery, we look for a skilled doctor to perform our surgery and help us get better. But social media, politics, and competing forces in healthcare have grabbed our attention with a constant barrage of conflicting information, and it's hard to figure out how to reconcile it. A Pew Research Center survey found that if there's an upside to the fact that we have a national problem with trust, it's that we're aware of it. About 2 in 3 Americans say it's very important that we raise the level of trust that we have in our federal government. A majority of Americans, 58%, also say it's important to raise the level of confidence that we have in each other. And around 9 in 10 say that we can make progress here. 2 of the most mentioned suggestions are being less partisan and embracing values such as honesty and kindness. The thing is, it's natural to get defensive or shut down when we're being talked down to or shamed for not knowing something. Older adults are especially familiar with this in healthcare settings and social settings more broadly. But when it comes down to it, we all generally care about the same things, the health and well-being of our families and neighbors, and we need to find our center again. So the big question is, how do we do it? I personally love the Braving framework for trust that was created by social work researcher Brené Brown, where each letter stands for a core element of trust. And I think this is really good for those of us who work in health communications and in health policy. B stands for boundaries. If you're clear about your boundaries and you hold them, and you're clear about my boundaries and you respect them, then there can be trust. There isn't trust without boundaries. R is reliability. I can only trust you if you do what you say you're going to do, and not just once. In research, it's the degree to which the result of a measurement, calculation, or specification can be depended upon to be accurate. And we saw this with temperature for older adults during COVID, which wasn't always, reported as being able to be a bit lower than for younger people, and we really had to press HHS on that. In what constitutes a fever. Being reliable is also admitting when we're still learning. We often miss the mark on this with each other. People can accept doubt and uncertainty, but unfounded confidence, even when it's well-intentioned, can cause mistrust. A is huge, it's accountability. I can only trust you if when you make a mistake, you're willing to own it, apologize for it, and make amends. You can only trust me if when I make a mistake, I am allowed to own it, apologize, and make amends. No accountability, no trust. V is vault. What I share with you, you will hold in confidence. What you share with me, I will hold in confidence. Here's the tricky thing about the vault a lot of times. We share things that are not ours in order to hotwire connection with someone else, right? If you don't have anything nice to say, come sit by me. And whenever intimacy is built on hating the same people, that's not real. I is integrity. We can't trust each other if we don't act from a place of integrity. It's choosing courage over comfort, choosing what's right over what's fun, fast, or easy, and practicing your values, not just professing your values, right? That's integrity. N is non-judgment. This is where you can ask questions or ask for help without being judged by me, and I can do the same for you. And this is two-way. If I think I know it all and I have nothing to learn from you or resist ever asking you for help, that's not a trusting relationship. The last one is G, generosity. Our relationship is only a trusting relationship if you can assume the most generous thing about my words and my intentions, behaviors, and then check in with me. So you would assume the person with false information on vaccines cares deeply about safety and about protecting their family. Pediatricians have made an art out of doing this when addressing vaccine hesitancy. And my dad is one of those. The Alliance for Aging Research strives to cultivate trust through all of this, plus empathy and a fierce commitment to dignity. We often say the quiet parts out loud to break through the sterile tone that's sometimes found in health advocacy. Our goal is to open doors to deeper collaboration and lasting change. We say we're small but mighty. That means we must work efficiently to have an impact. And one of the main ways we do this is by leveraging our award-winning educational materials and policy issues with the press. From February to the summer, we worked with Scott as our leader on this, with partners to fight against cuts to Medicaid, SNAP, and federal health agencies. Our work contributed to saving the Administration on Community Living, which funds services for millions of older adults and people with disabilities each year. We've had at least 100 press hits this year to date, and several in top-tier news outlets on vaccines, IRA and needed fixes, Alzheimer's and neuropsychiatric symptoms, cuts to Medicaid, SNAP, and intellectual property, which is my newest thing, and tariff issues. We try to maximize our social media and our podcast. This is growing old, which was called out by the Wall Street Journal late last year as the best podcast on aging. Thanks. Matt, hey Matt. Matt Thompson is our producer on that. We are blessed to partner in our health education and policy work on every issue that we work on, and we are thrilled and fortunate to have many folks here tonight. Thank you for coming, and their logos are featured up on the screen. We champion you like we know you guys champion us. And to all of you, for the many times we reach out, and sometimes I know I do it at the very last minute, thank you. And thank you for reaching back out to us to partner. That is trust in action, and we cherish that. Our second theme for the evening. Our second theme for the evening is empowerment, which is also one of our organization's values. We create evidence-based information for older patients and family caregivers to help them make informed, independent choices that lend to self-advocacy and improved health outcomes. We do not see empowerment being at odds with public health. We see public health as integral to empowerment and to our democracy. A key part of empowerment is accepting that people will inspire you one moment and utterly disappoint you the next, and not to let it shake your foundation. It can be hard, especially right now, to feel good about anything. There's dysfunction, there's conflict, there's corruption, there's cruelty. Despair is so easy, even reasonable, in moments like this. And this is when I look to American poet and novelist Charles Bukowski, whose epitaph says, "Don't try." What Bukowski points out is that merely trying is often the most subtle form of avoiding. He says, quote, "Too often, people complain that they've done nothing with their lives, and then they wait for somebody to tell them that this isn't so. But they have it right. They've done nothing. Show no courage, no inventiveness. They did what they were told to do. They had no resistance, no thoughts of their own. To be empowered is the opposite. It is self-permission to do something, even when you sometimes wish you didn't have to. I know how lucky I am to do this work, and I'm grateful to have this responsibility, even on hard days. I am deeply passionate about our cause, the people we serve, and the people we partner with to make it happen. I also really enjoy cultivating relationships with the people I lead and encouraging their leadership. Having meaningful work is a privilege, and it's hopefully good for aging. Nothing we do at the Alliance is done by one person alone, and in fact, our strength comes from depending on each other in pursuit of our common goals, and these include our Alliance board members, our supporters, and our many advocacy partners. On that note, I have an important list of thank yous, so I appreciate you joining me and acknowledging everyone. First, thank you to our host with the most, Kevin Rigby. You have such a wonderful... You have such a wonderful, uplifting energy, and we just love and look forward to sharing the stage with you each year. Thank you to Michelle Marcus, who chairs our board of directors. And others on our team when they crash our calls regularly to offer wise counsel. Our entire board of directors supports us and our mission in countless ways and serves as our guiding light. In addition to Michelle, we are fortunate to have several board members here with us tonight, and I'm going to ask those of you in the room to please stand and ask all of you to join me in acknowledging them. We are grateful and proud to partner with healthcare companies in pharma, bio, and device, and others in the public and private sectors of healthcare and healthy aging. This evening would simply not be possible without the kind support of our sponsors. Please join me in applauding them at the end. Our award underwriters include the Claude Pepper Foundation, sponsor of the Claude Pepper Award for Advancing Healthy Aging, Eli Lilly and Company, sponsor of the Distinguished Public Service Award, and Advanced Medical Technology Association, or AdvaMed, supporter of the Silver Innovator Award. Our silver sponsors include Biogen, Gilead, GSK, Johnson & Johnson, and the combined powerhouse that is the Davos Alzheimer's Collaborative, the Global Alzheimer's Platform, the Global CEO Initiative, and Us Against Alzheimer's. Our bronze level sponsors are Acadia, the American Medical Association, Bristol Myers Squibb, the Consumer Healthcare Products Association, Healthy Women, Lundbeck, Neurocrine Biosciences, Novartis, Otsuka. I love how everyone's like cheering for themselves, like, go table 20. Yeah. All right. Novartis, Otsuka, Penn Quarter Partners, Prevent Blindness, PWR, and USP. Additionally, we thank our fabulous conversation sponsors, Applied Policy, all right, Astellas, AstraZeneca, Eisai, Merck, and Omnicom Group. It's like sports teams. Okay, our conversation supporters are Ardelyx, Genentech, Naver, the National Alliance for Eye and Vision Research, and Pharma. And our conversation innovators, the Biotechnology Innovation Organization, the Consumer Healthcare Products Association, Exelixis, King & Spalding, National Consumers League, National Pharmaceutical Council, Owen Mumford, Pfizer, Reservoir Communications Group, and Venable. Let's give all our sponsors a round of applause. I am so proud of the individuals I get to work with who tackle the issues and keep us running smoothly every day. They are all super smart, motivated, and kind, a true team of people that are essential to each other's success and to mine. Thankfully for us, Sarah was able to lead the spectacular event this year. And thankfully for those of you who despised it, there is no kale salad this year. And she told me to tell you, you're welcome. Please join me in thanking Sarah and anybody who's still in the room here. Please stand up, our entire team. They're good cooks. All right. Our final theme for the evening for us is always healthy aging. There's been a lot of conversations this year about leading through change. Our team is lucky to get a daily reminder that change is the essence of aging. So leading through change is just leading. There's a quote I love and aspire to by Pema Chodron, an American Tibetan Buddhist nun. And she says, "You are the sky, everything else is just the weather." When you age with your integrity intact, you know who you are, and others know who you are. Don't wait for the perfect moment to arrive. Don't waste time chasing comfort. You're here, impossibly, improbably, miraculously here. That is reason enough to act, to love, to show up, to do what matters while you still can. Now, before I leave the stage, I'm supposed to tell you that if you take pictures, they don't count without tagging us and using our hashtag, Heroes in Health. We will like them and keep the party going. On behalf of the Alliance for Aging Research, thank you for all for being here. We are honored to have you join us, and I hope you enjoy the rest of tonight's program. Thank you.
Well, we also have to thank Sue's husband, Steve, who's here, for all the hours that he's not there. And her father, Dr. Glick, if you can stand up. Unbelievable, the father's here who obviously did that. Look. He has so much vitality, he threw the chair before he got up. And I love it. That is healthy aging. Now, let's do some push-ups. All right, that being said, so anyhow, Sue, congratulations to you, the Alliance team, outstanding. This is all in 1 year it occurred. But let's welcome to the stage now Shannon Stehauer. Shannon, as you've had many years up here, serves as Vice President of the Federal Government Affairs for Eli Lilly and Company. In her role, she works with lawmakers to advance policies that support the pharmaceuticals innovation. Prior to Lilly, she worked for PhRMA, the Pharmaceutical Research and Manufacturers of America, which is the trade association that represents the leading biopharmaceutical research companies in the United States. She also spent several years on Capitol Hill working for Senator John Hoeven, the Republican from North Dakota, and Congressman Mike Rogers, the Republican from Michigan. Thank you to Eli Lilly, who's been outstanding and generously underwriting the Distinguished Public Service Award. So Shannon, you're up. There she is.
All right, good evening, and thank you, Kevin. On behalf of Eli Lilly, I'm honored to recognize Congressman Neil Dunn, this year's recipient of the Distinguished Public Service Award. This award is presented annually to a Republican member of Congress who exemplifies leadership in promoting policies that advance medical research, innovation, and care for Americans as they age. Tonight, we celebrate Congressman Dunn for his unwavering commitment to improving the lives of older Americans. It is an honor to recognize a dedicated public servant, veteran, physician, and legislator who works consistently to champion the health, dignity, and well-being of our aging population. A member of the House Energy and Commerce and its Health Subcommittee, Congressman Dunn has used his platform to elevate the voices and needs of older adults, particularly those in rural communities across Florida. His leadership has strengthened access to essential care through the extended telehealth services and support for community health centers. He has worked throughout his career to eliminate distance and lack of transportation barriers to high-quality health care. As a proud member of the House Doctors Caucus, Congressman Dunn brings firsthand medical experience to policymaking. His advocacy includes co-signing a bipartisan letter urging HHS and CMS to reconsider step therapy policies and Medicare Advantage, and to move away from harmful policies that delay and restrict access to the very treatments many older adults need to maintain stability and continuity in their care. His efforts to protect the well-being of adults are clear in his collaboration with the Alliance to address appropriate use of antipsychotic medications in nursing homes. In Congressman Dunn's outreach to CMS, he emphasizes the need to protect both patient safety and access to evidence-based treatments for individuals living with Alzheimer's, Parkinson's, and other neurodegenerative conditions. It is evident that in his advocacy is driven by a deep belief that older adults in skilled nursing facilities deserve care that uphold the highest standards of both quality and dignity. Dr. Dunn spearheaded the bipartisan FIND Act, the Facilitating Innovative Nuclear Diagnostics Act, that would give patients greater access to diagnostic tools that can better detect Alzheimer's, among other conditions. Serving in the U.S. Army as a surgeon for over a decade, Congressman Dunn understands deeply the complex and overlapping health needs of older veterans. He has worked tirelessly to improve the continuity of care and access to innovative treatments, especially for those impacted by chronic illness and service-related health conditions. He is a force for progress in advancing medical research and innovation, supporting initiatives that drive discovery in the treatment of cancer, neurodegenerative diseases, and other conditions that disproportionately affecting aging Americans and their families. It is an honor to recognize Congressman Dunn tonight for his commitment to fighting for a healthcare system where aging is not met with obstacles, but with opportunity, compassion, and care. Accepting the Distinguished Public Service Award on his behalf tonight is Sarah Gilbert, Chief of Staff. Sarah, please join me on the stage to accept the award.
Thank you, Shannon. Good evening. I'm Sarah Gilbert, Chief of Staff to Congressman Neil Dunn. I'm honored to be here with y'all tonight to accept this award on Congressman Dunn's behalf. Dr. Dunn so wishes that he could be here with us, and he has asked me to relay his sincere gratitude to the Alliance for Aging Research and Eli Lilly and Company for this recognition. This award is a reminder that real progress only happens when advocates, researchers, caregivers, and policymakers work together. Dr. Dunn is proud to be a part of those efforts, and he's deeply grateful for this recognition. The Congressman prepared a brief message, and we would like to share it with you all now.
It's my honor to be recognized with the Alliance for Aging Research 2025 Distinguished Public Service Award. I'm proud to champion legislative priorities that align with an organization that is so patient-focused and research-oriented. When it comes to the science of healthy aging, there are myriad areas of focus, and I commend the Alliance for bringing together the right mix of experts, advocates, and patient voices needed to bring aging issues to the forefront. While I'm sorry I cannot be there with you tonight in Washington, D.C. at the gala to celebrate your many successes, I am honored to accept this award. I remain committed to ensuring that regulatory policy that FDA fosters, not stifles, innovation so that tomorrow's cures can serve American patients sooner. After FDA approval, I also know there are many challenges to getting payment systems to align with patient needs. That's why I use my platform on Energy and Commerce Committee to also engage CMS to ensure that coverage policy meets the needs of today's patients. I urge you to continue to use your voices and your resources to educate Congress and advocate for legislation that aligns with your goals of creating a policy and regulatory ecosystem that fosters improved outcomes for patients. God bless.
Well, thank you, Sarah, and please pass along our many thanks to Congressman Dunn for his leadership and his outstanding work. So now it's to present the next award, the Daniel Purry Founders Award. So we looked around, we said, well, who should do it? And really, there's 1,000 people put their hands up. We said, but who should really do it? And you know who's going to do it? Dan Purry! Yeah, so we got him out. It's unbelievable. We called Maine and got him evicted, got him down here. So who is Dan and why did we create this? It really, to think about, he's the founder and sitting board member of the Alliance for Aging Research, and he's my longtime personal friend. Dan has over a decade of experience on Capitol Hill. He's advised both Democrats and Republican legislators and U.S. presidents. He's talked about aging, medical research policies. He's led influential coalitions focused on Alzheimer's and stem cell research. He also served as an advisor, really an advisor on top research institutions. Along with his policy work, Dan has a distinguished career in journalism, earning multiple awards, including a Pulitzer Prize nomination for his impactful contributions. He's also an author, a 2022 autobiography, Village Kid, a memoir, and I don't know, and they don't have this in here, but he also did a TED Talk. Now, I don't know if you've ever seen a TED Talk, but you think about content. Dan worried about what he would wear. So those who were watching him, he had a black turtleneck. He walked particularly slow because that gives you gravitas. So he practiced that, and I saw him. So I was like, it was great to watch this. And I said, shouldn't you worry about what you're saying? He goes, so this is the former founder, has come back to give his own award out, and we are blessed to have him with us, my dear friend.
Wow, Kevin. My piece of advice for all of you tonight, if you want a success in life here in Washington or anywhere else, find yourself a big-hearted Irishman, make him your friend, and keep him close. So thank you, Kevin, for being that guy for me. It's really wonderful to be here and a great pleasure and an honor to join you tonight for our presentation of the Alliance's 2025 Founders Award. The Alliance has always and always will fight to advance medical research and its blessings to enrich the health and well-being of people as we grow older. And there's precious few individuals who embody that mission better than this year's honoree, Dr. Georges Benjamin. He is the executive director of the American Public Health Association, also known as the APHA. This past year, the Alliance has been fortunate to work closely with Dr. Benjamin and the APHA, and let me tell you, he is the real deal. For more than 20 years, he and the APHA have been a force for ensuring equal access to public health for all people and at all ages. Dr. Benjamin is an emergency physician by training and a public servant by calling. During his time as Maryland's Secretary of Health and Mental Hygiene, he led efforts to strengthen Medicaid to better serve the needs of older adults. He's widely regarded as one of our nation's foremost experts in public health emergency preparedness, in making sure that older people in particular are not left behind in times of crisis. And that's fitting, isn't it? Because many of us believe all Americans are experiencing a time of crisis right now concerning health care and especially public health. When you go home tonight and go back to work tomorrow, if you go back to work tomorrow, and a lot of you are going back to work whether you know it or not, because there's a lot to be done. But when you do, say a word of thanks that Dr. Georges Benjamin and people of his quality are fighting the good fight to secure healthier, safer, and more productive lives for all Americans. Earlier this summer, we learned that Dr. Georges Benjamin wouldn't be able to be with us in person tonight, so we reached out in advance with congratulations and to discuss the current state of public health in America. I'd like to share a little bit of that conversation with you now, so let's watch. Hi, everybody. I'm Dan Perry, the founder of the Alliance for Aging Research and a current board member. I'm pleased to be speaking today with Dr. Georges Benjamin, who's being honored with our 2025 Founders Award. This award is presented every year to an individual or a group who is helping to transform the way we think of aging in order to achieve healthier, longer lives. Dr. Georges Benjamin is a distinguished physician leader and for the past 23 years has been executive director of the American Public Health Association. The American Public Health Association is one of the nation's most venerable health organizations for all Americans, speaking out in defense of science on key public health issues and policy. Dr. Benjamin and the APHA help ensure access to care for all and to help eliminate health disparities. They do this through their publications and promotion and practice of sound public health information. It's no secret these days that a national consensus on good public health measures is under stress, even direct attack, as seldom before in more than a century. Dr. Benjamin's courageous and effective defense of public health in this fraught political environment has earned him and the APHA justifiable praise. For the past 3 years, Washingtonian Magazine has listed Dr. Benjamin among the 500 most influential people shaping U.S. health policy, and this year he was on the cover of the magazine. Dr. Benjamin, from all of us at the Alliance for Aging Research, we deeply respect and appreciate your leadership and moral courage. And therefore, it's our pleasure and our privilege to present you with the 2025 Founders Award.
Well, Dan, let me just thank you very, very much for this amazing honor. I want to give a hello to the Alliance for Aging Research and to the guests who have come together to celebrate the important work you all do on behalf of older adults and all Americans.
Well, it's really a great pleasure to speak with you today. You've been in the forefront, in front and center of
for decades promoting trust in science and championing public health. So I have to ask, what concerns you most today? And what gives you hope?
But Dan, you know, what concerns me the most is the acceptance by so many people, including some of our policymakers, of disinformation that it moves them from, quite frankly, reality. The discordance from things that they themselves would not accept if applied to themselves, and their support of things that, quite frankly, are not in their or even their constituents' own interests is quite remarkable.
Mm.
You know, after our nation's constitutional convention, Benjamin Franklin was asked, what kind of government would we have? And it's often said that he was quoted that a republic, if you can keep it. I got to tell you what gives me hope is that this political overreach that is occurring, and quite frankly, the amount of inhumanity that we're seeing in so many quarters really has awakened a sleeping giant of activism. You know, it's created a grassroots movement of people who are determined to ensure our democratic values and principles are upheld. Frankly, in other words, we've decided we're going to keep our democratic republic.
Wow. Well, that's a noble and proud challenge, and I hope you're right. You hailed the Supreme Court's decision on preventive care services as a win for public health, but as you know, that ruling also gives broad authority to the Secretary of Health and Human Services. And you have characterized the current secretary's guidance on vaccines as, and I quote, very concerning. What advice can you give the advocacy community to ensure these hard-won protections for public health are implemented with integrity?
You know, the structure of our system, which we have crafted over so many years, is so important. And one of the things that I learned being a health commissioner, both in Maryland and then earlier in the District of Columbia, was that these are temp jobs. So the structure is forever. Secretaries are temporary employees. But I do believe that the health secretary must be the nation's chief health strategist. So we supported the authority to appoint members of the Preventive Health Task Force because we thought that was essential for the construction of our nation. Now, one of the other things that I've learned is having the authority to do something and using that authority wisely are two separate things. So we hope that the secretary uses this authority that he now has been solidified around these various task forces. We hope he uses those wisely. But if he doesn't, we should all work together to oppose him and fix these mistakes.
Very good. Given your long and admirable career in public health, please share with our audience an experience or a moment that shaped your decision to take legal action against dangerous policy shifts. And was this the first time that you felt compelled to carry the fight for public health into the courts?
You know, we've at APHA have done a lot of both litigation and amicus briefs, but this is the first time we've really jumped in with such assertiveness and fervor to make this happen. But you know, I grew up in Chicago and learned how to deal with bullies as a kid. You know, I got my lunch money taken away once, but only once. And one of the things that I learned is that bullies are weak and insecure, and you have to take them on directly. And one of the things we learned from the first Trump administration was that we needed to be more assertive. So when he got reelected, my staff and I sat down and said, okay, what's our risk tolerance and how assertive are we going to be? And so we crafted 4 principles that we thought were very important. Number one, make them follow the law, because we know in the past that he's often not followed the law. And of course, now pretty much everything they do is being done in a process that doesn't follow procedures and doesn't follow the law. Secondly, this flood the zone strategy they have, you know, I'm an ER doc, so I know how to triage. And we decided that it was very important to focus on the most important things and only a few things, meaning don't chase the shiny things. And then, of course, making sure that the negative impacts of their actions are known to all, so to make it public, so that people really understand what's happening to them and helping people to connect the dots. Because if you help people connect the dots and they see what's happening to them, they won't tolerate that. And then, more importantly, of everything else, don't practice anticipatory compliance. So when they say to do something, and we know this in violation of the law, we know they don't have the authority, don't do it. And one of the most important ones is diversity, equity, and inclusion, which 7 months ago was legal, non-discriminatory, and the most appropriate thing to do. And now they're trying to redefine it as discriminatory, presidential, and it is not. It's diversity, equity, and inclusion means that everybody gets to engage, that everybody has the opportunity for optimal health. And we've just decided we're not going to allow someone to redefine reality based on what we know.
Thank you, sincerely, Dr. Georges Benjamin. And congratulations again on receiving the Alliance for Aging Research 2025 Founders Award.
Dan, thank you very, very much.
He does indeed deserve our respect, our support, and our applause. Here with us tonight to accept the award on Dr. Benjamin's behalf is Dr. Susan Poland, Associate Executive Director for Public Affairs and Advocacy with the APHA, and Dr. Benjamin's valued colleague. We're honored to celebrate the work of your exceptional team, the work that you do, and we will present you on our behalf the 2025 Founders Award.
Good evening. I feel a bit superfluous considering you just heard from the man himself. But as you can probably tell, he is a very busy man and also an incredibly accomplished leader. He sends his deep appreciation for this incredible honor and asked me to share how truly grateful he is to receive this award. And if not for a long-planned and well-deserved vacation, he would be here today to accept it in person. Now, anyone who knows Dr. Benjamin knows he's a bit of a storyteller. You heard a bit of that during the video. So let me start with a brief story. Just a couple of days after the 2024 election, he called me around 9 p.m. to check in on me, but also to ask, how comfortable are you with risk? True to form, he was already 15 steps ahead, figuring out what we might need to do, thinking through all of the different issues that we need to focus on to protect the public's health. As usual, he was right on target. To be an effective advocate for public health, you have to be comfortable with risk. For nearly 21 years, I've had the privilege of working alongside Dr. Benjamin as his Associate Executive Director. In that time, he has led the association with brilliance, empathy, kindness, and courage. I know many of you have worked with him over the years, but let me take just a moment to reflect on his leadership in just the past few months. Under Dr. Benjamin's leadership, APHA has not only stepped up boldly and decisively to protect the public's health, we stepped out. At exactly 12:01 p.m. on January 20th, APHA filed one of the first lawsuits opposing the Department of Government Ethics for its lack of transparency. Since then, we've been plaintiffs in several major cases. We sued the Office of Management and Budget to get critical grant funds moving again. We challenged the unconstitutional dismantling of the federal government. We sued RFK Jr. for undermining the integrity of the Advisory Committee on Immunization Practices. And we are the lead plaintiff on APHA versus NIH fighting to ensure that programs focused on DEIA, LGBTQ+ health, vaccines, and other vital priorities that were targeted by an illegal executive order can, in fact, continue to be awarded and considered. Dr. Benjamin has always understood the importance of connection between public health and healthcare, research and practice, between agencies and between people. Long before it was popular or urgent, he championed the idea that these sectors need to work together, not just during crises, but well before disaster strikes. When the pandemic began, he quickly mobilized organizations across sectors through the Alliance for the Public's Health, helping create a more coordinated response. More recently, recognizing the growing threat of misinformation, he launched the Campaign for the Public's Health, a social movement focused on advocating for evidence-based decisions in an increasingly noisy and misinformed world. Throughout his career, Dr. Benjamin has been a fearless voice for science, for data, and for policies grounded in evidence. He's been a leader in public health, emergency medicine, community and ambulatory care, fire and EMS services, and emergency preparedness. He has so many more accomplishments I could list, and I could go on for days. But let me close by saying this. It is my honor and privilege to work alongside Dr. Benjamin, and it is even greater honor tonight to accept the honor of the Daniel Perry's Founders Award from Daniel Perry himself and the Alliance. Thank you so much.
Thank you, Dr. Poland, and certainly thank you, Dr. Benjamin. The two of you are a formidable team, and we appreciate everything. Before I make my announcement prior to dinner, Dan Perry's wife is here, and you got to have equal time. So, Carol, would you stand up? Because you put a lot of years in with Dan as chairman. There she is. Dan, did I do okay bringing her up? Oh, sorry. Anyhow, that being said, you know what time it is? It's dinner time. So, yeah, right? We're a little hungry here, but I want to remind everybody that you have a silent auction in front of you. We have some great items there, so please take in consideration. The silent auction is open to 8:30, so please get your bids in as soon as possible. Secondly, there's going to be a photographer coming by. Always remember, put your chin out, smile, get your pictures, and enjoy dinner. We'll be back. I hope everyone enjoyed or is enjoying their dinner. If you haven't finished, please continue to eat. We also want to announce that the silent auction has closed, so a huge thank you to those who participated. If you have won, you will have received a text or an email notification. If you can, after the dinner, please go to the Madison Room just outside the ballroom after the conclusion, and you can get your goodies. So I hope you won, I hope you bid, and congratulations to the winner. So now it's my really privilege to introduce to you Michelle Marcus. Michelle, just some background. One, I've really had the joy and privilege of being on the Alliance and working with the Alliance for many years on the board. And I can tell you, I know many of the members, the board is fantastic, but the special sauce is the chairperson. The chairperson makes the difference, who keeps the stewardships alive, keeps the craziness down to a minimum, and really motivates you to achieve a lot of those things. And I gotta tell you, Michelle is that leader. So let's hear from her. She's tremendous.
I think getting an introduction from Kevin is a highlight of my existence, which is second only to probably being honored by being the esteemed chair for the Alliance for Aging Research Board. So thank you, everyone. On behalf of the board, it is my pleasure to be here this evening. This year's award recipients inspire us with their grit, their leadership, and their unwavering courage. We are honored to consider these heroes in health as our partners in helping people live longer, happier, and more productive lives. Please join me in congratulating all of them. I also want to thank my colleagues on the Alliance's Board of Directors. Each board member has made significant individual contributions to helping the Alliance with its mission. They are equally invested in making sure our older Americans receive access to the care and treatments necessary to live longer, healthier, and rewarding lives. And it is such a joy to spend time with each and every one of them as we get to learn from each of them every day. So thank you to them. I also want to thank I also want to thank each of you because the generous corporate, organization, and individual contributions received at our annual Heroes in Health celebration allow the unparalleled and incredible Sue Peshin and her team to be out in front of bringing awareness to causes like heart valve disease and neuropsychiatric symptoms of Alzheimer's, advocating for Medicare affordability and access issues, vaccines, and underneath it all, trust in science. This is all in service to helping older adults become engaged in research and advocacy through programs such as Talk Nerdy and Pathways to Parity, and the many other initiatives that the Alliance work on throughout the year. Your being with us tonight inspires us to keep moving forward each and every day to ensure that the experience of healthy aging in this country is one of progress, dignity, kindness, and as Sue put it so beautifully before, bravery. We gather to reaffirm our commitment to the hard work still ahead. We are more than just guests at an event tonight. We are a community united. We'd like to think fueled by a shared purpose to change our nation's narrative on healthy aging and equitable access to care. We ask that you please make a personal contribution this evening by turning to the very convenient iPads that are on your table and clicking on the Donate Now button at the bottom of the screen. There you'll find a QR code, like the one you see that is going to join up on the screen behind me at any moment, because tech usually goes so well and easily in all of our lives. Thank you. An extra prompt for using that QR code is always good. So anyone who needs assistance with the QR code, please raise your hand and an Alliance staff member will be happy to help. Please know that all contributions tonight are fully tax deductible, and every contribution, no matter the amount, will have an enormous impact. I also would be remiss if I didn't thank everyone who contributed to the online auction, our first time doing so, and thank you to our board member, Jay, who helped bring it all together. Very fun, and my son thanks you. Thank you. We are deeply grateful to each and all of you for your support, and we are confident that together we are paving the way for meaningful change. Congratulations again to the honorees, to Sue, and to the entire Alliance team for an extraordinary event in these extraordinary times. Now I'll hand it back over to Kevin, our hostess with the mostest, to introduce our final award. Thank you, Kevin.
Good. Thank you, Michelle, and again, thank you for your leadership. Now, we have tonight's Silver Innovator Award is going to be presented by Bobby Patrick VI, who serves as the Senior Vice President of Government Affairs at AdvaMed, the MedTech Association. He oversees AdvaMed's state affairs and partnerships with external stakeholders, including patient advocacy organizations and physician groups. Previously, Bobby served as the Vice President of Strategic Growth and Policy at Medical Alley Association, where he led the state and federal government affairs efforts. He also oversaw the membership work at the association, where they experienced growth in membership revenue, engagement, and retention at the leadership level. The Alliance is grateful to AdvaMed for its generous support of the Silver Innovator Award. Please join me in welcoming Bobby as he honors the groundbreaking work of Dr. Fulusho Fokarde.
Good evening, and thank you, Kevin. The Silver Innovator Award recognizes an outstanding individual who has furthered research and innovation in healthy aging. It is my pleasure to introduce Dr. Fulusho Fokarde, a relentless advocate, visionary leader, and nationally recognized force in the fight against cardiovascular health disparities. As CEO of Cardiovascular Solutions of Central Mississippi, Dr. Fokarde has transformed care delivery in one of the nation's most underserved regions. Under his stewardship, the organization has implemented cutting-edge preventative programs, aggressive screening protocols, and advanced treatment strategies for peripheral artery disease, or PAD, resulting in an extraordinary 88% reduction in amputation rates in just over 4.5 years. Dr. Fokarde has exemplified the highest standards of leadership as chair of the Association of Black Cardiologists PAD initiative, where his influence has stretched from the community levels to the halls of Congress. Through his advocacy, the first ever bipartisan peripheral artery disease caucus was established, driving crucial awareness, policy engagement, and action towards a critical health issue. His collaboration on the Federal Amputation Reduction and Compassion, or ARC Act, reflects his steadfast commitment to policy-driven change that fights for the lives and dignity of patients, too often overlooked by the healthcare system. In May 2024, Illinois became the first state to pass legislation modeled after the ARC Act, mandating PAD screening coverage for at-risk individuals. His efforts have been honored with the American Heart Association's 2023 Lewis B. Russell Award, followed in 2024 by the Association for Black Cardiologists Public Policy Award. In that same year, Dr. Fokarde's pioneering efforts to combat diabetes-related amputations were the subject of Bloodlines Mississippi, a powerful documentary examining a medical system stacked against the residents living in the epicenter of the amputation epidemic and the determined physician fighting to break the cycle. The film was later selected by the Nobel Prize Foundation for inclusion in its Fighting Disease: 3 Stories from the Fields of Medicine exhibition and screened at film festivals around the world. Bridging his achievements as both a physician and policymaker, Dr. Fokarde has emerged as a unifying force, bringing together legislators, academic institutions, industry leaders, faith-based organizations, and community stakeholders to advance a bold but incredibly important mission: to expand access to quality care, promote cardiovascular education, and champion legislation for early detection and life-saving intervention. It is our distinct honor to welcome a transformative leader whose work is redefining what equitable healthcare looks like. Dr. Fokarde, please join me on stage to accept this award.
All right, time to party. Good evening, everyone. Folks in the back, can y'all hear me? Good evening. We have a quorum. This is how I start all my events. I tell folks my story. I woke up at 3 o'clock Central Time in Mississippi to be here tonight. And so all I need is 5 minutes of your time, all right? 5 minutes. Just 5 minutes. Thank you very much. Wow, what a beautiful event, and just want to thank Kevin and the leadership, the board members. Good evening, good evening, good evening. Deeply honored to receive the 2025 Silver Innovator Award for the Alliance for Aging Research. Especially meaningful on the final day of Peripheral Artery Disease Awareness Month. How about that? My congratulations to my esteemed fellow honorees and to the incredible communicators that we've seen on the stage tonight. To be recognized by an organization that has spent decades elevating awareness, advancing science, shaping policy for older adults is profoundly meaningful. Not just for me, but for patients and the communities that we all serve. This award is not simply about innovation. It's about transformation. Transformation of lives, transformation of systems, and of possibilities. For me, this journey is deeply personal. See, I'm the son of Nigerian immigrants who taught me resilience and a relentless work ethic. In the year 2000, just weeks before I took my medical entrance exam, known as the MCAT exam, I lost my best friend and my only brother unexpectedly. His passing became my compass. It taught me that life is fragile, that tomorrow is not promised, and that medicine must be about urgency, competency, compassion, trust, and hope. Dr. Martin Luther King Jr. said it best: life's most persistent and urgent question is, what are you doing for others? So that question has guided me every step of the way. It led me to the Mississippi Delta a decade ago, a region with the fewest physicians per capita and the highest amputation rates per capita. I did not come at the invitation of an institution, but compelled by moral compass and the grace of God to a land that is abundant in culture, in history, yet marked by some of America's deepest injustices: economic, educational, housing, political, infrastructural, and above all, health disparities in healthcare. There I've seen how aging and zip code can be as deadly as any diagnosis. I've seen patients lose limbs not because the science failed them, but because the system did. No awareness, no access, no second chance. Symptoms dismissed as just aging, arthritis, gout, or as we say down south, the gouch. We call that the amputation lottery. And this is where our mission converges. The Alliance for Aging knows that inequities in aging are not numbers on a chart. They are lived realities. They fight for culturally sensitive education, for including underserved population in clinical trials, for access to simple, life-saving diagnostic tools. This is the same fight I've devoted my career to against peripheral arterial disease, or PAD, or PAD, as folks say on the Hill. So PAD is one of the most common, most costly, most deadly, yet most preventable epidemics in America. PAD affects 21 million Americans over the age of 40. Nearly 1 in 5 Medicare beneficiaries over 65. I repeat, 1 in 5. Yet fewer than 1 in 4 even know they have it. The annual economic burden of this epidemic is estimated to be $200 billion, paid for by every single taxpayer in this room. But too often, the symptoms are dismissed. Among Medicare patients who lose a limb, most are undertreated, not offered limb-preserving procedures, and 60 to 80% will die within 5 years of that amputation. I repeat, 60 to 80% will die from that preventable amputation. That mortality rivals many cancers. But unlike cancer, there is no screening endorsed by the U.S. Preventive Service Task Force. There's no mandated evaluation before an amputation by medical societies. And too often, no one seeks a second opinion. You don't know what you don't know. This is not a technological problem. This is a PR problem. It's a detection problem. It's a coordination problem. It's a solvable problem. A simple ankle brachial index test that's cheap, quick, non-invasive, can change the trajectory of any patient's lives with peripheral arterial disease. This is why we fight for the Amputation Reduction and Compassion Act, known as ARC Act, H.R. 307, H.R. 307. This is why we call for systemic evaluation before limb loss. This is why we raise our voices as we are tonight. But numbers alone do not stir the soul. Stories do. Humanize your patients. Tell their stories. And that's why projects like Bloodlines Mississippi, a Nobel Prize Foundation documentary, matter. They humanize the data, and they show the world what inequity looks like, and why action cannot wait. And that's why, I woke up at 3 a.m. Action cannot wait. I had to be here tonight to tell this story. So tonight, I accept this award not for myself, but for the patients whose courage humbles me every single day. For the older adults in rural towns across the South who deserve the same dignity as those on the Upper East Side of New York City where I trained. Every family told an amputation was their only option. For every community still waiting for health justice, this is for you. Congressman John Lewis reminded us, never, ever be afraid to get and make some noise and get in some good trouble, necessary trouble. So closing racial gaps in vascular care and ending preventable amputations, this is necessary trouble. And so I accept this award not as a culmination, but as a call to action, to work alongside the Alliance and continue on the arc that the Association of Black Cardiology has set forth, work alongside policymakers, clinicians, students, and communities to ensure that aging America is not defined by disparity, but by dignity. Thank you for this honor. Thank you for believing, as I do, that we can and we must do better. To my teammates in the SIP, as we call it, Mississippi, to my family, my supporters, and my friends, thank you for your love, encouragement, and belief in me that what we're doing will continue to keep us going, keep us pushing, and give us strength daily as we continue this battle. Thank you for your time. Get back to partying.
Well, thank you, Dr. Fakarita, and we are glad you got up at 3 in the morning for us, and aren't we fortunate to have him here and the work he does? It is now my pleasure to welcome, on behalf of the Alliance, my good friend Tom Spulek. He's chairman and president of the Claude Pepper Foundation, and he's here to present the Claude Pepper Award for Advancing Healthy Aging. In addition to his work at the foundation, Tom is a partner at the law firm of King & Spalding and chairs its government advocacy and policy here in Washington, D.C. Tom also serves as an adjunct professor at the Florida State University College, but before entering private practice, Tom served as staff director and general counsel of the House Committee on Rules and then as general counsel for the U.S. House of Representatives. 20 years ago, the Alliance for Aging Research and the Claude Pepper Foundation, they formed a partnership to create the Claude Pepper Award for Advancing Healthy Aging. In addition to this year, marking the 20th anniversary of the award, we commemorate Senator Pepper's 125th birthday, which occurred earlier this month. Tom and the entire team have been steadfast, passionate supporters of the Alliance, and we are truly grateful for the friendship and continued commitment that makes it possible to have the Claude Pepper Award. So, in veneration of these momentous milestones, we curated a special tribute to say thank you.
The Claude Pepper Award for Advancing Healthy Aging was established 20 years ago to honor a Democratic member of Congress who is leading the way for policies encouraging medical research, innovation, and care to benefit Americans as they grow older. Supported by the Claude Pepper Foundation, this award is named for the Honorable Claude Pepper, who fought tirelessly in both the U.S. Senate and House of Representatives to help those in need. As chair of the House Select Committee on Aging, he sought to strengthen programs for older adults and disabled Americans, including Social Security, Medicare, and Medicaid. Through the Claude Pepper Foundation, the Center, and its related policy arms, the Congressman's legacy lives on and is dedicated to research on aging, alternatives to long-term care, and other issues. The Alliance for Aging Research thanks the Claude Pepper Foundation for its 20 years of continuous, generous support.
So on behalf of the Alliance for Aging Research team, it is our honor to provide you, Tom, with this signed photograph from our archives of the Honorable Claude Pepper. So let's get Tom up here to accept the award. Sue, would you like to come up? We're going to ask Sue to come up here and sign it. This is yours, buddy.
Thank you so much.
Sue's going to take a picture with you.
That's great. Yes, sir.
Wait, where?
How'd you get there? Thank you so much, Sue. Thank you all, and it's really wonderful to be here. I've had the really good fortune of being at this dinner over the years, and the thing I think I look forward to most is Kevin's introduction. He's a great guy. I also want to say how fortunate I am to be here tonight with the Alliance. It's been a number of years, beginning with Dan, when we first talked about this idea. Sue has picked it up so well, and it's something that, God willing, we'll keep doing as long as you want us to do it. But we're here tonight to honor a really phenomenal legislator and person who really, really cares about the health and well-being of all Americans, in particular the aged. It's my pleasure to present this year's Claude Pepper Award for Healthy Aging to another true champion for America's older adults, and that is Senator Amy Klobuchar. Before highlighting her remarkable work, I'd like to thank the Alliance for creating that video tribute to my former boss and one of our nation's heroes for aging Americans. It was wonderful to celebrate what would have been his 125th birthday a few weeks ago at the Claude Pepper Center at Florida State University, where it all started. As the video said, through the foundation, the center, and related policy arms, the Congressman's legacy lives on and is dedicated to research on aging, alternatives to long-term care, and other issues. You know, today, certainly we honor him as the man, but really what we have are all of those good works and the goals and the values that he's left for others to carry on, those who are brave enough and care enough to pick up that mantle. And again, Senator Klobuchar is that person that we honor tonight who is doing that. The Claude Pepper Award for Advancing Healthy Aging is given each year to a member of Congress who demonstrates exceptional leadership in advancing policies in medical research, innovation, and care to benefit Americans as they grow older. Senator Klobuchar has been a tireless advocate for expanding health care access and protecting vital programs like Medicare. Her leadership has improved the lives of millions, ensuring that older Americans receive the care and support that they not only need, but that they deserve. Through policy, legislation, and action, she makes clear that quality of life as we age is not just about health care, it's about ensuring dignity, independence, and financial security, and certainly we owe it to them. At a time when families are burdened by rising health care, Senator Klobuchar has made it a priority to push for accessibility and affordability with her successful efforts to cap the costs of insulin and reduce out-of-pocket expenses for millions of Medicare beneficiaries, helping to ease the everyday challenges older Americans face in accessing health care. The senator has additionally been a very strong voice for people living with Alzheimer's and America's caregivers, ensuring these groups are able to receive the treatments, protection, and support that they rightfully deserve. Through bipartisan legislation like the Alzheimer's Caregiver Support Act and the Americans Giving Care to Elders Act, she has worked to provide families with the training, resources, and financial support they need to care for their loved ones. She's been a steadfast defender against major cuts to vital programs, including Medicaid, SNAP, ACL, and the Affordable Care Act. When the Alliance was advocating on these issues, they were grateful she was there alongside them, leading the charge. Her advocacy extends to protecting older Americans from fraud with her authorship of the Seniors Fraud Prevention Act that advances safeguards against elder abuse. With her work to expand telehealth access and strengthening Medicare and Medicaid, the Senator has fought to ensure that older Americans are not left behind in the rapidly changing landscape of healthcare delivery. So it is in the spirit of Claude Pepper, Senator Klobuchar's leadership is grounded in compassion, informed by experience, and driven by a deep belief in dignity for all as they age. Her efforts reflect the work of the Claude Pepper Foundation and the Alliance for Aging Research to advance sound policies that improve care and enhance the quality of life for older Americans. Senator Klobuchar, we thank you for your exceptional leadership and advocacy for older adults, and thus it is my privilege to present you with this year's Claude Pepper Award for Advancing Healthy Aging.
Thank you. Thank you for your leadership. Thank you for continuing Senator Pepper's work. So I was a little late because there were a few things going on the Hill. I bring you greetings from the U.S. Senate where, things are really going well. I'll get to that in a minute. But I also bring you greetings from the state of Minnesota where the women are strong, the men are good looking, and all the health care is above average. So I want to thank you for staying through the evening. I want to thank the doctor. I loved being able to hear his incredible speech, thinking about how a son of Nigerian immigrants is in this incredible position to do good, reminding me again that immigrants don't diminish America, they are America. I could give a whole talk about one of our healthcare challenges, which I'm not going to do, about making sure we have enough workers, and so much of that solution, in addition to training and doing the work that we need to do, is making sure that we treat these incredible doctors and people that want to study at medical schools in our country and want to work in our country with the dignity they deserve, because we need them in our country. So, and I have a feeling that your parents didn't have $100,000 when they came over here, but I'm going to let that go. So, Claude Pepper's legacy of improving the livelihoods of seniors, truly an incredible legacy. From his work on guardianship and elder abuse, Medicare, Medicaid, he transformed what it meant to grow old in this country. He understood that dignity matters. And he held on to those beliefs through his many, many decades of service in the Senate and the House. I love that we discovered that he actually received awards from both President Franklin Delano Roosevelt and President George H.W. Bush. That's with the people I work with, some of the ages there, I thought 125, well, hey. So I'd also like to thank Sue and all of the organization's members for your work. It couldn't be more important right now. We all know the obstacles that are out there. That's what this fight is actually about right now. As you were sitting and maybe drinking some wine, we were drinking water over in the budget meetings. We were not able to come to an agreement, but the Democrats all voted for our bill, which includes a very clear clarion request, demand that we do something to restore health care for the Americans. I can't even, I really think that they should view this as an opportunity, and I mean that, because the Affordable Care Act tax credits right now, talking to some of our rural hospitals in Minnesota, I went to 13 counties last week, so I'm kind of an expert on this. That actually makes a difference, because the people in the rural areas, over a quarter of our farmers are on what in my state is MNsure, but it's the Affordable Care Act. And as our hospitals told us, they're already hit with the Medicaid cuts. They're already hit with Medicare cuts because it was an automatic trigger of $500 billion in Medicare cuts because of the enormous debt that the bill put on this country, and that's how the law works. But the Affordable Care Act problem is that if people can't afford their insurance, Kaiser just came out today and said it will be a doubling of premiums starting November 1st. They're just not going to get their insurance. And then they show up at the emergency rooms, as you all know, and they show up without insurance. And I say this as someone who, in the last Congress, was #1 for bipartisan bills. I was #3 for passing bills into law. Grassley beat me. He's not 125, but, you know. And so I really believe that, you know, courage is often not standing by yourself and giving a speech in that place. Courage is whether or not you're willing to stand next to someone you don't always agree with for the betterment of this country. So I believe that, but that breaks down when people just rubber stamp what one person wants. And they don't say, man, as one of my farmers said last week, hit by the tariffs, hit by some of the workforce issues, hit by the health insurance costs. He said it's the perfect storm of ugly. So that's what this vote was about tonight. I hope that we're able to come to an agreement. I hope that the pride the president takes in the art of the deal is real, and that we are somehow able to come to an agreement where we do something to help Americans and the entire healthcare system as we go forward. So, Medicare, Medicaid, over 110 million Americans depend on Medicare and Medicaid. It is the biggest anti-poverty programs in the history of America, and sadly this summer we just witnessed the biggest cut to those programs in the history of America. So earlier this year we marked the 60th anniversary of Medicare and Medicaid, and we look back at this monumental achievement, and we should be strengthening these lifelines that Claude Pepper fought for, not undermining them. So, first of all, I always look at the positive. We look at the progress that we have made, right? We have made progress on these programs. Poverty for seniors have gone way down. In part, that is Claude Pepper's legacy, right? We have capped out-of-pocket drug costs, as was mentioned. We have finally done something when it comes to insulin, so people aren't rationing their insulin. Jean Shaheen just had a spotlight hearing, that's what we call them because we can't have our own hearings, today on the Affordable Care Act issues. And there was a woman, it reminded me of what was going on with insulin. There was a woman who, from Maine, who has MS. And she talked about how when she started processing how much these premiums would be and how she couldn't afford them, and how she couldn't afford then the medication. And by the way, a report just came out that we've seen increases in over 600 prescription drugs in just this last 9-month period. And she figured out, she asked her doctor, she met with her doctor and said, can I ration my MS treatments? And he said, no, it puts pressure on your brain. You can't do that. It's not like you can just have 1 week and then do another week. That's what people are dealing with right now. That's not political theater. That is real life. So when I look at the drug issue, by the way, that has been one of my callings, and that is to finally unleash us from what, for some reason, Congress put into law, which was a ban of negotiation on drug prices under Medicare. We actually did that 2 years ago, and the first drugs came out. They were drugs like Eliquis and Xarelto, Januvia, Jardiance. I like to impress a room of healthcare officials that I can say these drugs right. But we were able to do that, and I hope that continues, because otherwise we're just going to be stuck where we were. The other thing I wanted to address as we get through this, I'm going back to the Capitol. I'm in leadership, and we're just, again, we want to work out something, but we are really focused on this healthcare issue, is the bipartisan work that's gone on Alzheimer's. I think you all know that 1 in 3 seniors dies with Alzheimer's or related dementia. Nearly 7 million Americans are currently living with Alzheimer's. More than 11 million caregivers provide over 18 billion hours of care each year to Alzheimer's and dementia patients. And for so many people who we call the sandwich generation, they're stuck in the middle. They're taking care of an aging parent, and then they're also taking care of their own kids. It is not an easy place to be. I always remember my own moment with my mom, who had had knee surgery. It was a pretty minor thing, but she was temporarily in an assisted living. I was the chief prosecutor. We had a major murder case happen. My daughter was 4 years old. We were visiting my mom on a Saturday, and the jury verdict came in. I had to say to my mom, laying there on her painkillers, you just watch her right now. I got to go over. I cannot, this is sandwich generation. I cannot bring her to this murder verdict at age 4. I cannot do this. And I said, so Mom, you got to stay here. And I look at our 4-year-old daughter, Abigail, and you are not leaving this room right now. Oh, real good idea, like it's against the rules. I come back an hour and a half later, verdict's good, come back. And I get in the room and my mom's asleep and there's no kid. I'm like, shit. I start running around the assisted living and I find my daughter with a group of seniors in the cafeteria eating a huge vat from the cafeteria of pudding with the huge spoon. So like I said, it's not easy to be in that middle space. And when people have parents with Alzheimer's, it's even harder. So that's why I've done everything from work on the wandering issue with Senator Grassley to make sure that we actually got this great merger with the autism community and the senior community to be able to pass our bill to better fund police departments when they are trying to track people down and bracelets and things like that. But for me, this Alzheimer issue and the research and the fact that we have increased, maybe we want to do it again this year, NIH funding every single year on a bipartisan basis for the past decade. For me, this is personal. My dad, who is this renowned, incredible person, grew up in a hardscrabble mining town of Ely, Minnesota, went to a 2-year community college, and ended up with a degree in journalism from the University of Minnesota. Ended up interviewing everyone from Ginger Rogers to Ronald Reagan, to Mike Ditka, and my dad was the chief sports writer about the Vikings, and he wrote a book which is sadly still relevant today called Will the Vikings Ever Win the Super Bowl in the early 1980s. But to see that incredible life and success, and then in his late 80s and early 90s, to have late onset Alzheimer's, and to have that moment where you realize he doesn't know who you are, but yet he still embraced singing Christmas carols and knew every single word to the Notre Dame fight song, even though he was nowhere near Notre Dame, but it was because a Catholic boy growing up in Ely, that's what you knew, that was your team, to Slovenian drinking songs that he could sing to the very end. And Doctor, you would appreciate they were not Nigerian, but they were Liberian caregivers, of which we have a major, major population in Minnesota, both Nigerians and Liberians. And these Liberian caregivers, my dad, at the end, was kind of joyful, and he had such an incredible vocabulary that they put a dictionary by his bed so they could learn these new words, most of which weren't swear words, so that was good. But in an all-time moment I will never forget, one of them called me aside and said, "Your dad said that last year he had lunch with Isaac Newton?" And I'm like, she goes, I looked it up. I go, no, that's not true. But in the end, he was surrounded by family, and I know that is not everyone's experience with this disease, but I literally saw my dad climb the highest mountains, he's a big mountain climber, and go to the lowest valleys with all of this. And it just makes me so committed to not only helping caregivers, but also looking for this cure. And with this incredible work that's been done with mapping the human genome, which is just unbelievable. Minnesota's the home of University of Minnesota and also Mayo Clinic. And you look at the potential, if done right, I say if done right and harnessed in the right way, AI to cure rare diseases. These things, we should be at the cusp of medical development. We should be moving forward in the world leader. So these cuts and freezes and things to NIH is one of the things we're really fighting for right now. Because I just see us as this world leader in this space. We don't want researchers to move to other countries. We don't want them to give up and stop what they're doing. We don't want to stop the flow of this incredible talent from other nations into our medical schools and into our medical faculties. And that's why this fight right now, it might seem like, what are you talking about with this budget? That's what this is about to us right now. So my hope is that we can move forward and that the work that we've done and that you have done in this area and that Claude Pepper did in this area will lead to the next great thing. Claude Pepper once told his colleagues, when you go home tonight and you close your eyes and you sleep and you ask, what have I done today to lighten the burden upon those who suffer? He said, at least you can say, I helped a little bit today. That's the least we can do, and that's what we have to do. So thank you so much. I'm honored to receive this award. Have a good evening. Thank you, everyone. Keep up the fight.
Okay, here we go. First of all, we're coming to the 2 minutes, the last 2 minutes here. And how do you end with this? First, let's give a big round of applause to all the honorees, the heroes in health. All right. Second, let's have the Alliance for Aging Research team stand up and get a big thank you for tonight's wonderful dinner. And one last shout out to Sue Peshin, the CEO. And as we close, the biggest thank you should be to you. You are our partners. You're the ones who are every day out there fighting along with the Alliance. So to everyone who took the time out to come here to be supportive, give yourselves a round of applause. All right, I know one of the finest things is us ending on time, which we will. Out there are gorgeous miniature things are all dietetic. You can eat as much as you want. I know this, I've tried it. So please enjoy that. For those that have won the award, please make sure you pick up the award. And then next year, what we're hoping for to tell you, we're going to celebrate the 40th anniversary. Please come back. Please continue to support. I hope you had a wonderful dinner. Thank you so, so much.